All right. Well, thank you everyone for showing up. I will call this meeting to order and welcome you to our November 3rd, 2021 meeting. As some of you got up this morning, walked out this morning like I did, you felt the fall weather this morning. Looks like it's going to get pretty chilly this coming weekend. So I'm happy to see everyone survived all the ghosts and goblins over the Halloween weekend, and I appreciate you being here. I do, as Paul was saying a moment ago, I do want to apologize in advance, but I do have to step away a little early from this meeting for another obligation. So just to let you know that up front, and a little more housekeeping too. Our next regularly scheduled meeting is supposed to be December 1st, but we may have a conflict with that because it's World AIDS Day, and I believe there's a breakfast scheduled that morning. So would anybody be opposed to us moving our next meeting 1 week further and to December 8th on a Wednesday? Anybody opposed to that? Okay, so we will have our next meeting on December the 8th then. So moving right along, I'm very excited to welcome and introduce Mary Cummings. She's our new wellness manager with the city, and some of you know she's replacing Jan Park. We're very excited to have her. And Mary, if you wouldn't mind, would you please give us a brief description, or a brief introduction rather, and tell us a little bit about yourself?
Absolutely. I'm Mary. I grew up here in Charleston. I grew up in West Ashley. My husband and I live in Mount Pleasant now, and his family's in Mount Pleasant and my family's on James Island. So we're all here, which is great. I went to nursing school at MUSC. I worked there for about 5 years, transferred over to East Cooper, and then I found this position. Also, before I went to nursing school, I was a personal trainer, yoga instructor, and nutrition coach consultant. And I'd always wanted to find a way to put my nursing and that, kind of lifestyle wellness together. And I happened to just see this posting, and, I thought it was perfect, and I got a call back. So it's day 3, but so far it really is such a great fit. I'm so excited to be here, and all of the things that Jan has put in place, I think, are absolutely wonderful. So I'm looking forward to building on those and seeing what people want, and we can continue to grow and, have everyone be happy and healthy. So just looking forward to being here. I'm glad to be able to be a part of the city I grew up in, and it's great.
Great. Thank you so much, Mary. We're excited to have you. And this is a great committee that we have here of some great local experts in their fields. And if you don't mind, I just wanted to see if each of us would take just maybe a minute or two and introduce ourselves. And I'll just kind of go around in the order of my screen, and I'll call on Taylor Lee first, I guess. So.
Hey, thank you for the introduction. I'm Taylor Lee. I'm the public health director for DHEC for the Low Country region, which is basically 1/4 of the state, 11 county region in the Low Country. And I have been absent for many a meeting. My colleague, Dr. Richardson here, has been attending, and she can attest that it's been quite a busy time at DHEC. We are starting to see some favorable numbers, meaning numbers going down. But that is what I do, and that is what I've been busy with, just like Dr. Richardson. And thank you for having me back at this meeting. Pleasure to be here.
All right. Thank you, Taylor. Kimbo?
Hi, Mary. Glad to have you aboard the committee. So I'm Kimbo Yee. I'm a professor in exercise science here at the Citadel in the Department of Health and Human Performance. And I've been part of the committee, I think, since May or June of this year. So a lot of my research is on physical activity and nutrition as it relates to overweight and obesity, youth populations, as well as our cadets here at the Citadel.
Love it.
Great. Mike, would you like to introduce yourself, Mike Seekins?
Sure, happy to. And welcome, Mary, to the city. We're glad to have you. I'm Mike Seekins, Charleston City Council District 8. Along with Councilmember Shealy, who we should all congratulate. We both got ourselves reelected last night. So we're around.
Congratulations.
Woohoo! We're around for another 4 years. Ours weren't quite as dramatic as some of the others you might have read about in the paper or seen on the news. But anyway, love this committee. I think it's really important to have you as part of our team, both in the city and with this group. So I think you'll enjoy it and be part of your very rewarding experience. So congrats.
Thank you.
Look forward to working with you.
Too.
Thank you, Mike. And Dr. Katie Richardson?
Hi, Mary. Welcome. I look forward to working with you. I'm the medical director of DHEC, as Taylor said. And I regularly attend these meetings and had lots of interaction with Jan. So feel free to call me with anything.
I'm sure I will.
Thank you very much. And Quentin?
Hi, Mary. Welcome aboard. I'm Quentin Tompkins. I'm 1/3 of the Government and Community Affairs team at MUSC. So welcome aboard, and nice to have one of our alum out putting everything to practice. So welcome aboard.
Thank you.
Thank you, Quentin. Jennifer Roberts?
Good morning, everybody. Hi, Mary. Welcome. I'm the executive director of the Charleston Dorchester Mental Health Center. And so we serve Charleston County and Dorchester County. We're mostly an outpatient facility for children and adults, but we do have one crisis stabilization center, which is a hospital alternative. But we're kind of your mental health person on the group.
Wonderful. Thank you.
All right. And Kimberly Butler Willis?
Good morning, Mary. I'm Dr. Kim Butler Willis, Director of Community Health for Roper St. Francis, and generally wherever Paul tells me to go.
I love it.
Other way around, but okay.
All right. And Mayor Tecklenburg, we're introducing ourselves to Mary Cummings. You probably have met Mary, but I wanted to give you an opportunity to say hello this morning.
Hey, Mary. Mayor Tecklenburg, John Tecklenburg here. Good to see you.
Nice to meet you.
And congratulations to Council Members Shealy and Seekings, who were both reelected yesterday.
Thank you. Thank you.
Amidst fierce opposition.
And, all right, let's see. Nick Osborne.
Yeah, hi, Mary. Nick Osborne. I'm the president and CEO of the Low Country Food Bank, and we serve 10 counties along the 10 coastal counties here in South Carolina, one of which obviously is Charleston. So really happy to be part of this committee, and obviously look forward to working with you in the future as well.
Yes, thank you.
Thank you. Carolyn, are you available to speak?
Yes, good morning, everyone. Carolyn Murray, and Mary, welcome to the team. Great to have you as a leader in our community. I'm a local journalist, a television news anchor, and I'm starting to swim, as Mayor Tecklenburg knows. I just got out of the MLK pool, and that's why you are not seeing me. My husband and I swim downtown Charleston in the morning, and no one wants to see us right now. So glad to always be a part of this meeting, and I look forward to your leadership and our continued work to make our community better.
Wonderful.
Thank you, Carolyn. Lori Yarber, are you able to speak? Okay, Lori may just be listening in a little bit while she's doing other tasks, and Aretha, are you available to speak?
Yes, good morning. I'm Aretha Powers. I'm the CEO of Federal Healthcare Network. That's our federally qualified healthcare center here. We serve the 4 counties of Charleston, Dorchester, Colleton, and Berkeley County. So welcome.
Thank you.
Thank you very much.
Councilmember Shealy.
Yeah, thank you, Lori.
Yeah, sorry about that. I'm trying to multitask and I'm not doing very well. Good to meet you, Mary. I'm Lori Yarber. I'm the Recreation Director at the City of Charleston. I too do what Paul Wieters tells me to do. And I'd like to tell all of you that Carolyn Murray is way underselling herself. She has been in our pool almost every day for the last, 4 months, and she's turned into quite the swimmer. So we're excited to have her in our program.
That's awesome.
Good. Well, thank you very much. I appreciate everyone taking a moment to do that. And
Thank you for that, Lori.
all right. Well, very good. Well, the next item on our agenda is to approve the minutes from the October 6th meeting. Can I get a motion for that? I think Paul sent them out Monday. So, or I will move to approve those if I can.
Second.
Okay. Thank you, Mr. Mayor. So that is, so those have been approved. Well, I guess we need to vote on it. All in favor of approving the minutes, please say aye.
Right.
Any opposed? Okay, the ayes have it. So as we move to our next agenda item, I'm going to ask Paul if he would to share the maps that DHEC produced for us that show the life expectancy in our community and to remind us of our focus of health disparities throughout our community. You might remember earlier this year that our committee went to city council to support health in all policies, and the council approved the city plan, which placed health in the fabric of that document. And we need to begin the process of prioritizing. So we, as leaders on this Health and Wellness Advisory Committee, can start this process and start moving forward. So I want to welcome Dr. Kimberly Butler to share the recommendations her subcommittee made to council. So Dr. Kimberly Butler Williams.
Thank you. So good morning again, team. So thank you, Paul, for showing that map that DHEC distributed that I think really sparked all of us. It probably surprised and shocked all of us because we didn't realize how much disparities are really plaguing our region, despite having access to so many resources, but it looks like it's limited to just a few. So because of the work that we do as a team, and another great point for Charleston is that we work so well together collaboratively between organizations. Many of the people, or some of the people on this call, were actually a part of that subcommittee within the special commission that address health disparities and environmental justice. So we were able to make sure that some things were aligned and intersect with other plans, much like the health and all policies. So the special commission, we came up with 2 overarching long-term goals, and that was to improve the life expectancy of minority and our underserved communities by implementing policies and programs that consider the social determinants of health, giving all citizens the opportunity to reach and enjoy optimal health. And the second was to increase the number of high quality subsidized healthcare providers on the peninsula. And so within those 2 overarching goals, we had about about 10 strategies that we wanted to offer up. Thank you, Paul, that we wanted to offer up to this committee at large, because we know that this will probably be the committee that put legs on most of these options. So you'll see on the screen, and I won't read them all, but some that I do want to highlight so that you see the symmetry and the synergy is the first, and that was to mandate a health and equity in all policies approach for city government, city-sponsored programs, nonprofits, and community members. And so you just heard from Councilman Shealy that was indeed passed. So we should start to see more opportunities where health and all policies is recognized, not just in the city, but with those that they fund. Mary, this might be of interest to you. We also included in here language about healthy eating and physical activity by incorporating some obesity prevention tactics like sidewalks and healthy vending, green spaces, making sure that in our city expansion and city planning efforts that those things are considered. One other, or a few others I want to mention, we had a member on our subcommittee that was well-versed in the with the insurance providers. And so making sure that we're not losing funds on the table, our resources. So acknowledging those class standards, the standards for culturally and linguistically appropriate services. So promoting that through the city, but then also making sure that we're working with our managed care organizations with withholds and incentive initiatives, using those services that they provide to cater to the residents of the city of Charleston and even throughout the county. And then lastly, the last thing I wanted to mention, and forgive me, Paul, I'm going to go to mine, was the last overarching goal. And the last 2 strategies was to offer public transportation waivers for medical and social support appointments that extend outside of the peninsula. We know that transportation can be a major barrier for people that are seeking healthcare and social support services. So it would be awesome if the city could work with CARTA in order to provide waivers so that adults and their families could get to the appointments on time. And then also encouraging non-traditional hours for healthcare providers within the city of Charleston. So we know that most of our businesses, health-focused businesses, they close at 5. But if you're working a 9 to 5, it's going to be hard for you to get to those agencies, especially if you cannot take time off. We know that many companies are going through an employee shortage. So wouldn't it be awesome if one day a week our healthcare facilities offered an extended hours, maybe operating until 7 or 8, just to make sure that we have access available for all those who need it. So those were some of the major things that I wanted to pull out. Certainly you'll see here 180 Place, so collaborating with them to make sure that we fully understand the needs of the homeless and develop some innovative solutions. That's another great one that's on here. But you guys have this at your disposal. Paul did send it out when he sent the agenda and the meeting link, but I'm here to answer any questions that you all may have.
Okay, any questions?
Anything on here seems jarring or inappropriate? Or did we significantly miss anything?
Kim, I guess I would ask the question, is there any priority item that would be, if we put them on pecking order, where do we start would be the best places to start looking at these? Is it just tacking the first two to begin with and work on what we have through, well, we're working on the health and all policies, and our subcommittee task group can work on that internally as to what that will look like. But encouraging healthy eating, physical activity seems like it'd be something very simple between what we just heard in our introductions with the Low Country Food Bank, with the Citadel's emphasis on from Kimbo and from what we do. I mean, are those the easy low hanging fruits that we could start with on this list, or what would be your thoughts?
I think so, Paul, just because work is already being done there. I think it's easier. I know that Roper St. Francis, we have a focus on diabetes management right now. So the encouraging healthy eating and physical activity would work well within that structure. And I know MUSC and FEDER, they have strong focus on chronic disease management as well. So I think some of these are low hanging fruit that we could easily jump on and see some significant impact. Some things that I think would take more time would be like the waivers for transportation, because that has funding implications, our budget implications, and even some of the more systemic things like working with our managed care organizations are the class standards that would take more time. But certainly the first two you mentioned, and even collaborating with 180 Place feels more feasible and practical to me immediately.
What is the, working with the homeless and that sort of thing as far as access to healthy foods? Is there some way that 180 Place could, I know when we were in nursing school, we did a lot with them. But what about like a garden or something where people would have a way to, they're participating in that ability to eat healthy foods and learn about it while they're doing it, which would also be a very low cost to the city. And it gives people access, because I know a lot of times, when you're being given food, it's not always the healthiest. And if we want to encourage healthy eating, I think we have to have an access point. So, maybe we could even get volunteers to build a garden, or, help plant plants, or have someone come down and do teachings or something like that. I don't know, I just don't know what access is like as far as healthy foods, but if you don't have access, you're not going to eat them.
Right, Mary, you're spot on. And I know Low Country Food Bank, they do some classes where we talk about healthy eating and how to, and opportunities to explore new vegetable options. They do a lot of that, but it would be amazing if we could start a garden downtown. I know we have maybe one or two in North Charleston, those community gardens. So it's not novel to our region, but certainly something that we don't have on the peninsula right now. And correct me if I'm wrong.
I don't believe so. I know, we're just lucky that we have such a weather where we can basically grow all year long. And I think that there are probably there's a little, garden centers and stuff, or I know there's one lady named Rita's Roots. I don't know if you guys have ever heard of that. She's up on Meeting Street and has a big container store. Maybe we could engage them in the community to help grow, or they do a lot of teaching, which is so much fun. Just because if you're given an option and you're hungry, you don't really care if it's healthy, you're just hungry.
Right.
So
I saw Nick go off mute. Yeah.
Yeah, sorry, Kim. Yeah, just to add on that, I think you're spot on as well. In terms of looking at different options and ways to access more nutritious foods. And as you said, obviously at the Low Country Food Bank, and we focus a lot on foods to encourage, and a lot around taking food and encouraging the nutritional components of it, but also in terms of how the composition of meals and how you make nutritious food. but also just to say the point, Mary, that you referred to in terms of gardens as well. There are quite a lot of organizations out there in our community that are already focusing on providing support to encouraging urban gardens. And for example, the Green Heart Project is an organization that we've been engaging with quite a bit. And they do some tremendous work, both in terms of urban gardens, both working with through the education system, but how that can then expand out into the surrounding communities as well. And there are multiple benefits from that, not just the vegetables that are grown, but also in terms of how that serves as a platform to encourage issues of nutrition, but also a platform for communities to engage in addressing many of their other challenges and issues that they face as well. I mean, they have an urban garden here in the city that has been established and has environmental benefits as well, because it provides the opportunity for an environment for seniors who live in the area to actually have better access to an environment that's much more friendly, more conducive than it was before as well. So I would certainly recommend, would agree with what's being said. And as I said, we've been engaging with the Green Heart Project quite a bit, and they've been really helpful in terms of some of the support that they can provide in that area.
Thanks,
Mayor Tecklenburg, did you have your hand up a moment ago?
Yes, thank you, Mr. Chairman, and thank you, Dr. Willis. Excuse me. Two things. One about working with 180 or the homeless, and sometimes we don't get the good stories out that are actually going on, and so we've actually made some progress over the last few years, ministering, if you will, to the primary medical needs of the homeless in our community through an angel of a guy named Alan Woods, and we connected him about a year ago with MUSC, and they've now assigned a medical director and some interns to go with him, and I think Jennifer, some folks from Charleston, Berkeley mental health travel around with him. So they have at 180 Place and at our navigation center pretty good connections with MUSC and Roper and local health care to provide those that are coming in the door. But Alan actually goes to the encampments, the hidden places where homeless people are living, and there are quite a few of them around, not like Tent City used to be, but 2s and 3s. And Alan knows where all these places are. And he's an amazing guy. He's a retired guy. He used to be like a, not a doctor, but a, emergency
EMT,
medical guy. And he's been doing this all on his own. And now we got him connected with MUSC. So I feel really, really good about that right now. Not many people know that this is going on because it's just so quiet behind the scenes, but it's really terrific. So I wanted to share that with you and everyone. By the way, he said, I've always used the statistic that of the homeless individuals, that 85% have either some mental or addiction issue. Alan says it's 100%. It's 100% of those who are living on the street. But anyway, so that's one thing. The other thing, the overall goal here is the life expectancy, right? And thankfully, Dr. Richardson and DHEC do a good job of keeping up with those statistics and all. So I would challenge us to prioritize those things that we, and when I say we, I mean mostly the professionals here, think will make the most impact on that life expectancy number. And let's focus on that. If there's something that can, move that needle, move that dial a little bit. I know there might be some low hanging fruit to do something, but I think if we focus on the things that would impact that life expectancy, that would be a good priorities to set.
very valid, Mayor. In fact, I think so. I called it low hanging fruit, but I really do think those first two would be pretty impactful, especially if we're all collectively working on it. So the health in our policies is a big shift anyway, because it's a systemic shift, right? And making sure that everyone is focused on health and everything that they do. And then the healthy eating and physical activity is less about education and more about structural changes, which I also think would garner some true impact in how people move. For everything that you just said, people make choices based on the choices that they have available. And so if we can start to provide more healthy options, sidewalks in their areas, these green spaces like the gardens, community gardens like we're talking about, I think people will naturally be more engaged and physically active in their communities.
Well, that's right. And once we drill down on those things, if we, even if it's just onesie twosie, if we could establish the numbers, the metrics, if you will, on each of these strategies that we plan to pursue, I think that would be very helpful over time, and then see if there's a relation to the life expectancy going up. So anyway, I think that would be a good approach.
Yeah. So maybe Paul, at another time or during another meeting time, we can really dissect, and you all have time to review the strategies that were proposed, and then we can come back to this large group and determine which are indeed the most impactful and feasible that we could all commit to collectively through our organizations and individually, and then start to strategize or build out what additional metrics could be to make sure that we're indeed moving the needle on the goal.
Okay.
That works.
Sound okay to everyone?
Yeah, maybe we could, in early January, maybe come back with some of those numbers over the next 2 months, really try to drill down and see what we can all find out for them.
Yep.
Okay, great.
Great idea, Paul.
And just to complete the circle, once we agree upon those things and what we're going to measure and focus on, I'd like to send it back up to City Council for their review and approval as well.
Okay.
Yeah.
Receive.
Okay, very good. Thank you,
forgive
Dr.
me.
Butler Willis. Appreciate, yeah.
Thank you. And I actually have to dip out. So Roper St. Francis is revealing its large strategic plan today. And so I'm dipping out for that ceremony. But if anyone needs me, please shoot me an email.
All right, great. Thank you so much. Appreciate your work. All right.
Just a quick question, if I may, and I apologize for interrupting, but is this information, Dr. Butler, we would want to report right now, or do we want to have another meeting and look at some other options and how we will move forward before we share this with the general public?
I think I would wait until this January meeting that Paul just proposed, because then I think we'll have more meat on our bones of what we actually want to do. But Paul, I'll yield to you and your guidance.
Well, I think it's a good question, Carolyn. I think I want to get Healthy Tri-County engaged in this as well, because they were at the table with us and everything we've discussed. And so together, as that we're all working in the same areas, I think giving us more time to be more unified will be better in what our numbers look like.
A great question. Thank you.
Thank you very much. I appreciate it.
Okay, so we're going to move on now, if everybody's okay, to our next agenda item. We're going to call on Dr. Katie Richardson to give us a community health update. And as I turn it over to Dr. Richardson, I'm going to let you know that I've got to slide out. I'm supposed to be on a 9:30, another Zoom call. So I appreciate everybody being here. Thank you so much. Dr. Richardson.
Thank you. So I have a few updates. Thank you for changing the meeting in December. I did want to expound on that a little bit. December 1st is traditionally World AIDS Day, celebrated. And we in the Low Country, in conjunction with the Fast Track Cities Initiative, the Mayor Tecklenburg, signed Charleston several years ago. We will host 2 events on that day. The theme this year will be reflections on 40 years of HIV, my voice, my action. We'll begin with a World AIDS Day breakfast from 9 to 10:30. That will be virtual, and there'll be 4 sessions for which anyone participating can sign up for 2. Those 4 topics will be faith, family, and HIV, conversations of sexual health with youth, Self-care is the best care, and living freely, personal stories of people living with HIV. I will share that registration information with Paul to share with this group once it's available. I'd love for any of you interested to attend, and that will be that Wednesday, December 1st. Following that, in the evening, our traditional World AIDS Day vigil will occur from 6:30 to 7:30 p.m. That too will be virtual. The speakers and entertainment will be live at the Unitarian Church, which is our traditional venue for that. But due to the continued pandemic, the Unitarian Church has asked that we only have those individuals in person and others joining virtually. Leaders from organizations across Charleston will share on how do we lead from the middle, and will be also available virtually. So more information on that to come, but at least that's the date and times for you to add to your calendar. Moving on to flu. We don't want to forget flu vaccines and the possibility that we could have a twin-demic this year. That's because we had very low numbers of flu infections last year, thankfully. We believe that's due to the preventive measures being taken to control the spread of COVID. So we are very much recommending that anyone and everyone go out and get your flu vaccine. Those are available at pharmacies, at your own provider. DHEC is working with the schools again this year with the school located vaccine clinics. We've already given 600 flu vaccines to children, and we've worked closely with the Charleston County School District. We have a few more schools to set up, but we do hope to get to the vast majority of those schools prior to the Christmas break this year. So we're working with school children, and we hope to set up community events as well shortly. When we have those on the books, I'll also share those with Paul so that he can share them out with all of you. We have not seen much flu activity yet in South Carolina to date, but the flu vaccine does take 2 weeks to become effective. So we're definitely recommending you go ahead and get the flu vaccine at this time. And finally, it's been a long time since COVID has not been on the agenda for this meeting, and that does continue. We have some great news from this morning. The CDC has now officially recommended the Pfizer vaccine at 1/3 of the dose given to those 12 and over for children ages 5 to 11. That was just released this morning. So pediatric providers, including hospitals, pharmacies, pediatrician offices, our FQHCs, are able to begin giving that vaccine today. We do recommend that anyone call their pediatric provider, because it still may be a few days before those facilities can be up and running with giving the vaccine to pediatric populations ages 5 to 11. But they are available soon, if not today. And we strongly recommend that group begin to get vaccinated. We are thankfully seeing continued decreases in COVID infections in our communities. But I do want to remind everyone that it is still the second leading cause of death in the United States as of October of this year, only trailing heart disease. So while our numbers are going down, it is still the lead above cancer, above accidents, strokes, for cause of death here across the United States. When we look at those vaccinated versus unvaccinated deaths, very much in the vast majority, we're still seeing unvaccinated population. So over a 6-time greater risk of being infected for those who are unvaccinated, but over an 11 times greater risk of dying from COVID for those who remain unvaccinated. And, you know, we traditionally have thought about sort of our older populations as those most at risk. But when we look at the leading cause of death by ages, in August, for instance, COVID was the leading cause of death for populations 35 to 64. So the leading cause of death in the US was COVID for those populations. So this is not just a risky infection for those who are oldest. And not only that, but when we talk again about this 5 to 11 age group, COVID was among the top 10 causes of death for those ages 5 to 14 most months of this year. So generally, not as risky for children, but certainly can be. We have now a very effective and safe vaccine. We also recently heard more evidence to say that natural immunity is not enough. The CDC just put out a study that showed that unvaccinated people with a previous infection were 5 times more likely to have a positive COVID test compared to vaccinated people. We saw a study earlier that we talked about at a previous meeting out of Israel that suggested that perhaps they were more similar, but this study really looked among hospitalized patients with a previous infection or vaccination 9 to 100 days earlier. And as I said before, you know, adolescents, not only those, you know, 5 to 11, but those that have already been approved, 12 and up, 93% reduced risk with vaccination for hospitalizations among adolescents. And I think I will stop there. There's some good information on the CDC website. They've come up increasingly with great infographics that can be used on your social media. Lots of information on how to talk to parents about the vaccine. Good information about, you know, what is it that parents are most concerned about with the vaccine. Those from a recent Kaiser Family Foundation study really looked at, it asked percent of parents of children 5 to 11 who say they are very or somewhat concerned about the following. The highest was not enough is known about the long-term effects of the COVID-19 vaccine in children. That certainly is the case. The vaccine has not been around long-term, so we cannot know the long-term effects. Increasingly seeing is what are the long-term effects of COVID disease, of long COVID, and of the changes that are potentially happening to the genetic makeup of those who have been infected with viral infections. We know that viruses have increased risk of cancers, and we certainly have no reason to believe that this one would be different than what we've seen with other viruses. We also know that that many of the side effects that we can be concerned about with the vaccine, such as myocarditis, are much higher in those who have gotten the infection. So certainly those are some of the sort of responses for those most concerned with the long-term effects. Serious side effects of the vaccine came in second, that their child might experience this. What we know to date is that fever is a little less frequent. These are the short-term side effects in children compared to adults. We continue to see that severe allergic reactions are rare, and that even in those highest risk groups for myocarditis, which are adolescent boys, what we see is that myocarditis is rare, it's mild, and it resolves quickly in those age groups. The third was the COVID vaccine might negatively impact their child's fertility in the future. And really, there is no evidence to suggest that the vaccine affects fertility in adults or adolescents. There's no increased miscarriage rate among the vaccinated. Unintended pregnancy rates are the same in those vaccinated and unvaccinated. And again, what we know is that there's some evidence that COVID disease may affect fertility. We see that in mumps. With the mumps virus, and we see some inkling that that may be the case with COVID infection, and we'll continue to follow that. So I think I'll stop there because those were sort of the most common concerns. I think we all have our work cut out for us to work with parents to allay their fears. But I do believe that, that this is yet another ray of hope that we will be able to put this pandemic behind us. I don't want to finish without saying that masks do still make a difference. We're still very grateful that the school district is really leading the state in mask use among staff and students, and that's really allowing our students as well as those in our working communities, to be able to continue to stay healthy and continue to go to school and work. So thanks. I hope that wasn't too long, Paul, and I'm happy to take any questions.
Are there any questions for Katie?
I have a quick question regarding what the thoughts are about a booster about 6 months to a year from now for children.
That's a great question. So currently boosters are not recommended for those under the age of 18 unless that child is immunocompromised. Then a booster would be recommended, and that 6 months is not necessary for those. We really don't even call it a booster. We call it a third dose for those who are immunocompromised. So we don't know when there might be a recommendation for children. I think we want to follow the science. And so we really want to follow those children 12 and up who were first vaccinated to see if we begin seeing breakthrough cases, but more importantly, if we begin to see any severe COVID with hospitalizations and deaths in that group. Even at this point in time, the boosters are really only recommended for those 65 and over and those 50 and over with an underlying chronic medical condition. So even in younger adults, it may be used in those 18 and over with a chronic medical condition, and it may be used in those who have an increased occupational risk. But there's not a strong recommendation even for those groups. So I think we would see that first. Following the science, and only then would we begin to talk about younger children and the need for a booster. So more to come on that. Great question, Carolyn.
Mayor?
So Katie, thank you for that information. And given that we have a whole new population from 5 to 11 who's now eligible for vaccine, I think it's incumbent upon all of us to spread the word, even though it'll be in the media and all. You saw how long it's taken for the general population to get vaccinated. I'm curious how schools are going to be able to participate. That's the logical place to catch all the kids. But if they're not going to be able to have mass vaccination in the school, it really will add the impetus or the challenge for us to get the word out to parents and through our clinics and other venues to get the vaccinations out. Does anybody know about what the schools will do?
Yes, Quentin, you can speak to it, but MUSC has been working closely with Charleston County School District. Go ahead, Quentin.
Yeah, we've worked out a plan with Charleston, with CCSD in particular, to hold some mass events in the evening hours at the schools where because the parents have to be present with the kids. So there is a campaign to capture those folks 5 to 11 that are interested in getting shots. We're also getting calls from around the state because, again, we're still traveling around the state and providing vaccines throughout all 46 counties. But for right now, there is a plan in place for CCSD to vaccinate their kids. And we will be hosting a myriad of events throughout the entire state to, again, capture anyone that wants a vaccine, but especially those who have been added to the list now to be able to get vaccines. So.
But the parents have to be with the kids, so it's not like they can show up for school and you can just put them through a assembly line, so to speak. And
yes, sir.
Yeah,
yes, sir. We require that the parents are present. Yes, sir.
Do you know if our clinic over on Lockwood, if they are administrating or will start today, being able to do 5 to 11s with parents?
Yes. So within the MUSC system, we will be rolling out slowly but surely throughout all of our clinics for the most part. Lockwood is actually the first one slated to provide the vaccines over there. And the tentative rollout or go live date is tomorrow. And as of the last word that I got, it's supposed to be tomorrow. And then you'll see it rolled out to Sean Jenkins, the Children's Hospital, and then the Summit Medical Pavilion up in North Charleston. And, slowly but surely throughout the MUSC system, as well as some community sites.
Great. Paul, would you get with Chloe and Jack and let's come up with some PR that we can do on our own through the city to help advertise that, and maybe through the Charleston Housing Authority also to let our residents there know? That'd be great.
Suggest maybe putting in a plug also for the Vax locator. So that's on the DHEC website, and that's the way that parents, in addition to what's available through MUSC, can see for all vaccine sites who would be able to accept, children ages 5 to 11, as well as older groups. And they can also make appointments generally through links on the Vax locator.
Great. We'll mention that too.
All right, thank you.
Thank you for that update. I mean, this is great news in my opinion, and we've got to all work together to get as many kids vaccinated as we can. It'll make a difference in the long run.
Absolutely. I hope to get my 11-year-old vaccinated before the weekend.
Katie, just a quick question on the vaccination. If, say I've had one shot and I get COVID, I know you've told me this many times, but I'd like you to just say it out again. How soon can I get a COVID shot after having COVID?
So you may get it as soon as after your isolation period. So that's usually 10 days from the time you're diagnosed or your symptoms begin. That would be the soonest. But generally, I think for the, we believe that the natural immunity generally is strong for at least the first 90 days after an infection with COVID. And so generally, I think it is safe to wait that 90 days or sort a few days, before that, such that it is allowed to work at that time. So generally, I say if you've had the one vaccine and then you get COVID before you're able to get the second, you may wait. We say 2 weeks after is when you're fully vaccinated. So I say generally get it sort of in that month, 2.5, which would allow you to be fully vaccinated at the end of that 90 days. Some people are concerned about short-term side effects from the vaccine, that it's almost like sort of a third vaccine. And so for that reason, I think that that sort of 2.5 months is probably the sweet spot. But for those who just want to say, I definitely don't want to get this infection again, I didn't like it this time, you can just wait that 10 days and get it at that time. And I wouldn't wait longer than the 90 days because as I said, it's just that natural immunity is not enough. We do believe it's strong, but only for the short term. And the vaccine really helps to complete that immunity, to increase the immune response, to be more effective against variants. So even with a prior infection, the vaccine is very important.
I had one employee tell me that the provider had told them one of the persons that gave them the test for the shot said, when you test negative, then you're good to be able to get the second shot. And I didn't know whether that was whether that was relevant or not. Would you recommend somebody getting another test before they take the vaccine?
We don't recommend testing again in that 90-day period because the PCR test, for instance, is a very sensitive test. So there may be viral fragments still in the nasal cavity. That does not mean the person is infectious. And it really, that does not change, that would not change my decision-making about when someone should get the vaccine. And it can complicate the picture, for those who are receiving those positive test results. Sort of what it means. So generally we recommend just going by symptoms, 10 days, unless you've had severe COVID. Anyone hospitalized with severe symptoms may need to wait up to 20 days. You can talk to your physician about that or provider. But generally after that isolation period, we believe you're no longer infectious and may get the vaccine then or wait until closer to that 90 days, such that you'll have that continued strong protection going forward.
Thank you. And then final, just a reminder that in December, Katie will be giving an update from the fast track cities. So that'll be on our agenda to get an update where we are with what y'all have been working on as a team. So, All right, any other questions for Katie or Taylor? If not, we'll go on to our last item on the agenda is just a community update. That's just our quick run through for each group that's on to just see what's going on, any special needs you may have, or things that you're working on that we can help you in to get the word out on. And I'll go ahead and start with Jennifer. If you'll talk to us about mental health.
All right, well, I thought I would share something that I think everybody knows about, but we do have an update. I want to see if I can share the screen real quick.
You have access.
Can y'all see that? Do y'all see the pharmacy van?
Yep, we see it.
Yes, ma'am.
Okay, so I wanted to just update you since we were talking about health disparities and what we're doing. It's almost been 4 years today that we started the pharmacy program with a group of different folks, and we go out every Wednesday to Mall Park and give out free fruits and vegetables to folks. So the food bank's been a big part of it, and right now I think Roper is still doing it, mental health, Charleston Center, Fetter's coming back, Access Health is part of it, but we've been doing it for 4 years, and we just added a new site. So we're going to Columbus Street from I think 3 to 4 on Wednesday afternoons, and now we're going to 32 Flood Street because we have a person now embedded in the housing authority. So we're giving out free fruit and vegetables there also. And I know you guys mentioned giving out vaccine and information through the housing authority. So if you want to somehow get me information, I can give it to our group and we can put the information out, because we also give out healthcare information because we're trying to obviously get people hooked up to mental health treatment, drug and alcohol treatment, primary care treatment. And so it's been a great 4-year thing. When we started it with the police department, and it's their pharmacy van, but we got it covered. So I didn't know if y'all had seen the van. So thought that was a good update for today, since we were talking about health disparities and what we're doing in Charleston.
What
Jennifer-
was that second location again, Jennifer?
It's 32 Flood Street.
Flood Street.
Mhm.
Thank you.
It's at the Housing Authority building down there.
Yeah, I just wanted to toot the horn of that. That was something that the police department called on the community to help them 4 years ago, how they could, the chief was looking at the health where his crime issues were in communities, and he realized that you can't help people until you at least address the items of the health and mental health and getting people to learn to talk to each other. So it was a great opportunity that the local health community, that all the groups you just mentioned, teamed up, and the police department was out there. They just really wanted, the reason for the food and vegetables were to get people to feel comfortable coming in and just talking first, before you then provide medical assistance or health issues and all. And it's been a great item out there. I'm glad to see that it's still continuing. So thank you for helping be a leader on that.
Yeah, thank you. And yeah, it has been good. And we've added some people and dropped off some people, and just hope to, if anybody else would like to join us, everybody's welcome. Or if you just want to give us information to put out there on the tables, we're happy to do that too.
And you still have South Carolina Hopes is still open through July,
South
correct?
Carolina Hopes is still there, yes.
Okay, I'll send that information back out. Nick, anything from the Low Country Food Bank?
Nothing particular, Paul, just to say that obviously we're coming into our busy time of the year with the holiday period coming up. So obviously we're scaling up a lot of our distributions, and it will continue to be busy over the next couple of months, busier than it normally is, as it's always busy. But obviously making sure that we can get what we need to out into the partners that we're working with. I mean, obviously, the usual challenges that I don't think I think others are facing as well. Obviously, access to things like turkeys, for example, have been a challenge for us in terms of being able to procure turkeys. But also, obviously, the cost of transport and other services continue to impact the cost of business. But obviously, we're finding ways around that, and obviously working closely with our partners. But as I said, the next couple of months will be a busy time of year for us.
Well, we are so proud to have you in our community. Mayor?
Nick, while I got
Yeah.
you, hope y'all don't mind me taking 1 minute. I was at a distribution last Thursday at Joseph Floyd Manor. There's a group that goes there on Thursdays, Friends of Joseph Floyd Manor, and they told me they lost their bread donor. It was, I forget what bakery. Could y'all specifically allow them to get some bread from you on Thursday mornings to take down the Joseph Floyd Manor?
No, absolutely. That's fine, Mayor. Let me follow up on that and make sure that we can ensure that they get some bread, as you say.
Yeah, and I don't think it's a huge requirement. They have 150 residents in the building, but anyway, if you check on that and
Sure.
let me know back, that'd be great.
No, absolutely, will do.
Thank you, sir.
Kimbo, how about Citadel?
Yeah, so it's been about a month since the Citadel removed its mandatory mask mandate to being indoors on campus. That decision was made a month ago due to our very low active case numbers of COVID, as well as a high percentage of the community that was vaccinated or had natural immunity. So since then, as of yesterday, we have 0 active cases, 0 cases of anyone in quarantine, isolation, and close contacts, which that's the first time I've seen that all year. So like Dr. Richardson said, though, we are keeping our guards quite high as the weather gets colder, and obviously as college students here at College of Charleston and Charleston Southern prepare to go home for the holidays, return, go home again, and then return. We need to be very vigilant about increased transmission over the next couple months with that coming up. And then, flu season is here, so we've had some opportunities to provide the flu vaccine on campus to our community. And then obviously, if the recent news about the boosters, I don't actually know if we'll be planning something with booster shots provided on campus. My guess is probably in the future. I just don't know when, but that's pretty much it from here at the Citadel.
Kimbo, are you doing anything special out in the community in the obesity side? I was hearing articles on the paper today about that, or in the news. And I just realized that, with all this, we've gone through COVID, how much obesity is starting to be a factor. Anything that you're doing locally or through the Citadel?
Not actively right now in the communities, but particularly hard to sort of partner up with a lot of the schools just because of the COVID risk. So even here at the Citadel, when we had our leadership day a couple of weeks ago, we typically send our entire freshman group out to the schools to speak with the kids. And with the increased risk with COVID, everything right now, we couldn't necessarily do that. So hopefully as the numbers get better, those partnerships and opportunities can be established in the future.
I think the city would love to be helping you to get that word out in all our areas we can, whatever that would look like. So
yeah.
Right, thank you. Quentin.
Nothing much additional. We discussed the 5 to 11 vaccines, and that's the big thing that we're gearing up for now, expanding it throughout our clinics and throughout the community. I will just mention the effort that Mayor Tecklenburg mentioned earlier. We refer to it as street medicine, and that's the group that's going out and engaging with the homeless and trying to set up medical homes and things of that nature for the homeless population. And also, in addition to that, we do have a community garden on campus at MUSC. And I just need to do a little more research about what we're actually doing with the things that we're growing in our garden. So that may be another connection that we can make there with that. And, I don't want to take away from something that's already been committed, but it may be another avenue or possibility for the residents downtown. So.
Thank you. Aretha. Let's see if she's still on. All right, I'll jump over to Carolyn Murray. Carolyn. That's where I cue you. I point to you and you're supposed to come on. Okay, then finally, I'll just wrap up.
I'm here. I apologize. My hands are soiled. I apologize. I am here. Always great to hear such good information. And if I may ask, for those of you who want to move forward with a particular story, something that you've shared today that you believe is of the utmost importance and needs to be shared with the community, please always let me know. I try to always make contact with Paul after our meetings and going back, but if there's something that you believe we need to share immediately or even in the future, I ask that you just kind of yank my chain on that. So thank you. Always good to be a part of this meeting.
Well, I'll share one last item that might be newsworthy. Is today the Charleston Healthy Business Challenge has a luncheon that the Lieutenant Governor is going to be speaking, and her topic is going to be the well-being, women's health and well-being in the workplace. So that hopefully will be an enlightening and engaging conversation at lunchtime today. So if you haven't got reservations and you still want to try to go, if you holler at me, I'll see what we can do to work you out into there. But that's an exciting program that we got going, and it's been very well received. And Carolyn has spoke many times there for us, so we're glad to have her aboard. All right, if nothing else, I will thank everybody. Remember, we're going to move our meeting to December the 8th so that we can participate in the December 1st World AIDS Day. Mayor, I got you.
So thank you, everyone, for your participation. I did want to make a request for a topic for next month. And as I mentioned, Alan Woods told me that 100% of the folks he visits who are experiencing homelessness have some mental health or addiction issue. And then we got a report from Talia, our kind of outreach person from the city who works with Alan and others experiencing homelessness, that the real Jennifer and them do a great job connecting with services on the mental health side, but apparently there's a real gap with the addiction side. We got the Charleston Center. They only have a few spots over there, and it seemed like the statistics were quite low, quite bad on us being able to effectively help those who are needing some attention on addiction issues and challenges. So let's just maybe talk about that, where we are, who's doing what, and think about how we might improve that a little bit next year.
Jennifer, I'll reach out to you and see what we can get some connections together to pull out. Thank you, Mayor. We'll add that to our agenda in December.
Great. Thank you all for your service. Appreciate it. Let's get those kids vaccinated.
Thank you all.
All right,
you.
bye.
Bye-bye.
Bye-bye.
Bye.